I had patients coming in yang hold their breath sampai pingsan, sampai fitting. One who would like slam bang his head against the floor until fracture. Doesn't he feel the pain though? Oh no, they're so angry because toddlers don't understand, they're egocentric. They go through that.
It doesn't stop them. It
doesn't. Yes. Suppose imagine you're so angry, you hold your breath sampai you sendiri pingsan. They have that capacity to
I don't think I can hold my breath sampai pingsan.
Yeah, because we were like, okay, I'm not angry anymore.
Okay, I'm gonna break the air. But kids can do that, you know?
Yeah.
For this episode of Ask the Boss Wellness Series, we have Datin Seri Dr. Nomee Ashikin Mohammed Radzi, a consultant pediatric cardiologist at KPJ Hospital, Ampang Puteri, and also a medical director at Salgate Selangor Specialist Hospital. Datin Seri, welcome to Ask the Boss podcast.
Thank you.
Could you share a bit about your journey in pediatric cardiology?
Boleh. Thank you very much, first of all, for having me over. I'm super excited to be here. And I'm glad in your wellness series too that you invited a doctor to come along, and perhaps we can share a little bit of knowledge for your public, for your audience. So just a little bit of background about myself. I graduated from the University of Manchester and then went on to do my membership in pediatrics and child health. When I came back to Malaysia, I entered the National Heart Institute, where I trained to become a pediatric cardiologist. And from then on, after spending time there, I then went on to private practice, where I do both general pediatrics dengan general pediatric cardiology. And we're talking about today, we're talking about pediatric cardiology per se. I must say my experience dekat IJN was an extremely good experience, because it is a fantastic training ground for all budding pediatric cardiologists or any cardiologist and cardiothoracic punya surgeons for that matter. So we have an amazing institution right here in Kuala Lumpur, which can deliver like the best service at par with all the best hospitals in the whole world. So pediatric cardiology ni coming from general pediatrics, where I look after well children, going into a center where I have to look after children who are born with heart defects. So that's a totally different punya ball game. I was so used to the children coming into the clinic and then they go out bouncing again when they're better. But then when you're dealing with children with serious defects, then you're talking about, a matter of life and death. So it was an eye-opener for me, coming from general pediatrics, masuk pediatric cardiology. But I must say, there are so many interesting things that we could share today with regards to pediatric cardiology.
And the reason why you chose cardiology as a subspecialty, is that right to mention, to
Correct.
classify
It is.
Yes, a subspecialty. Is it because you saw a lot of cases of children with heart issues, or is it because you...
I wish it was like in the movies where I was affected by one heart case and then I decided to become a pediatric cardiologist. But no. Unfortunately, my life is pretty simple. It was just a matter of I was returning to Malaysia and I was exploring which subspecialty to go into. And luckily at that point, the National Heart Institute was also opening up its doors. So I managed to secure a post there. And from then on, the rest is history, because I did find pediatric cardiology to be challenging, very rewarding, because of course, as I was telling you, this is a matter of life and death. So you have children coming in with, can you save my baby punya situation. It's not a matter of, okay, my son is having a cough, so he's going to get better. So it was nothing like that lah. So it was just a matter of just something that I just fell into, and unfortunately I loved the job. So it was really good.
And what does the typical day look like for you?
When I was in IJN, okay, I must tell you, I was at one point I was thinking, if I went home, my children would ask, who is this auntie? Because I was never home. Basically, you would have to leave early in the morning. We always have a morning meetings, because obviously being a tertiary center, you're dealing with all the difficult cases. you're talking about complex punya diseases and that sort of thing. So we always have a morning meeting, and then followed by a ward round, clinic. Clinics, normally we see about 100 to 150 patients a day.
Wow.
That's
Within how many hours?
We have to do it in the morning. Wow. So habis tu, then we go on to ward round and making sure. And if say there will be cath lab days, which means that's the days when I go in, I have to scrub up, and then we are doing intervention such as closing heart defects, that sort of thing. We're doing examination, that sort of thing. So it was quite a challenging thing. So you would go out before sunrise and go back after sundown. So that was a typical day dekat IJN. It was hard graft, but rewarding. And that was when I came across a lot of cases which really affected me lah. First time I came back, it seems simple, tetapi when I was in the UK, if a child needed to have their punya a drip up, they would put in a treatment room, mak bapak pegang, and then there will be like toys and all that to distract. It takes a lot of time, but that's how they want the patients to be treated, and that's how it should be. Sampai dekat IJN, okay, parents just wait outside. We're going to wrap your baby up. We're going to just try, because there are patients who are, number one, always coming in for procedures. So most of their veins have already been used up. So it's difficult. And then obviously, it's like a factory. It's one after another. We have such high volumes. So that one was for me. When I first came, I was crying. I was like, kesiannya, all these children are crying, and all that. But then I had to toughen up.
Yeah, crying because they are in pain?
Yeah, because I do see them in distress. So I don't like seeing children in distress. So to me, my role is always to make sure they're happy.
So it's just up to you and the other medical staff around the child to give comfort to the child.
Of course. But then we have to balance it against, this is going to be a difficult procedure because, as I was telling you, veins tak ada. And also because we've got 20 patients waiting to have all that done. And with so little staffing. So it is not an ideal situation, but it's something that we try our best to make sure that parents understand what we're doing and all that. One of the saddest cases I remember, we were called for an emergency code blue. Code blue means you have to come in for a resuscitation. Somebody had collapsed. So there was this child, obviously cyano. So somebody who is very, very deeply blue. Dia punya fingernails semua, you can see dah memang all the changes. So she had one of the more common punya blue heart punya syndrome, which is the tetralogy of Fallot. But they came all the way from Kelantan, and the parents ni pula didn't understand that if you feel that your child is not well, that you can call us up to come earlier. They waited and waited for the actual dates. So on the morning of the child having to come into clinic, she collapsed in the toilet. And we couldn't save her lah. So that was one of those things that would always stick to me, that I cannot forget. So pediatrics can be fun, but when you lose a child, the effect, regardless of how many that I have to go through, is still something that affects me.
But how do you maintain your own mental health after seeing all those?
That's a very good question. I remember that when I wasn't dealing with pediatric cardiology, I was just dealing with well children, let's say under accident or they had a serious infection to the brain. That's why taking vaccines is very important. So if I lose a child, and despite whatever we do, we understand as doctors, there's a higher being, Allah is there. So it really, despite your best efforts, the child still goes. That's when it really does affect me. And normally I would go on a long drive, trying to find some sort of macam nak tenangkan diri kan. So that's one of the things lah. Because losing a child is different from losing an adult.
How does a parent know if the child has some heart complications?
Okay, that's a good question. And it's something even KKM has just launched to make sure that all medical practitioners are aware, because one of the signs of children who have underlying heart condition is that they have poor growth. So you will see that instead of the growth going according to the punya growth chart, it is what we call flattening lah, or going down the lines. So that's one. Number two, we will also say, please monitor. If the baby is struggling to feed, they would be feeding and then they terpaksa stop because they're struggling to breathe. That's also a sign. But the other thing that all the hospitals are now having to do is to make sure that you check the oxygen saturations.
So you need to have that device at home, yeah?
Jangan. Please everybody do not go out and buy devices.
Okay.
It's done when the baby is born. So we will pick up then. So don't worry. Tetapi there are certain diseases where saturation will remain 100%, but there may be a big hole in the heart and that will cause poor weight gain, poor growth. So that's one of the biggest signs of heart problems.
Right. So you detect this at the infant stage when the baby is born?
Correct.
Right. Okay.
That's the ones that we can detect. And there are some where you can only detect when, remember when we masuk a university or we go to college, that they will have a medical screening or whenever you go to work. So that's the other one that we tend to pick up also. This is the ones that you pick up late. And if it's too late, there might not be much that we can do. So unfortunately, as life goes, it can throw curveballs at you. So we do try to make sure to catch all these things before it happens to that stage.
So heart complications is detected primarily at the infant stage. So once the baby is discharged from the hospital after being born,
Yes.
that means if there's no issue then it's okay, or do the parents have to look out for any telltale signs?
So that's the good thing about being in this country where we have a good medical provision. You have to take your child for the jabs, the immunizations. That's when we do our routine examination to make sure we're looking at their development, their growth, or any other concerns. That's how we catch them. So inshallah, they shouldn't fall through the net lah. Unless you're talking about people macam going into macam pedalaman and that sort of thing, and that would be where we will lose them.
Is it just due to genetics, or can it be caused by virus?
Okay. Two very different things here. The ones yang genetics, sebenarnya genetics tend to be the ones yang associated with chromosomal punya abnormality. Bermakna your Down syndrome, your Edwards, your Turner syndrome, those are the ones yang normally would have an accompanying heart defect. So about 30% of children with Down syndrome will have a heart defect. That's higher proportion than the general population. General population 1 in 6,000 live birth sahaja. So chromosome, genetic defects. When pregnant, the other thing that we look out for if mom has diabetes or exposed to smoking or she herself is smoking, and then that may be a problem. So that's one thing. The other thing is viruses lah. That is what we call acquired, not congenital. Congenital means you're born with it. So bila you acquire, sometimes you're unlucky enough, some viruses can cause what we call myopathy. Artinya, the heart muscle tu sendiri akan be affected and inflamed, and sometimes it cannot function as well. So remember dulu, I don't know whether you remember HFMD punya case, a long time ago, a different sort of strain caused the myopathy, and there was an outbreak masa tu dekat East Malaysia. Sometime back, at least 20 years back.
From foot and mouth, it becomes it goes to the heart.
Yeah.
Okay, I didn't know that.
There was an association, but a different, very rare type of strain.
Very rare.
I don't want
that's
everybody
comforting
to
to
think,
know.
okay, I'm going to get HFMD, which is so common, you're definitely going to get a heart problem. But sometimes it may happen. Yeah.
Yes. And how does this children with heart condition, how do you deal with their mental health? Did you give the parents advices? I mean, what sort of...
And that's a very good question. Okay, if there are, you see, heart defects, there are defects that we can handle and we can close and we can repair, and they are classified as cured. So that's what we were doing when we were in IJN. We could put in some occluders, we can send for surgery, so they get cured from their heart disease. Some, unfortunately, are very heavy. So we can do what we call palliative punya staging. So we would try to get them to have an extra length of time alive. And so much so that, let's say, if we're doing a great job and the heart can function, they can go up to now in their 40s and the 50s. Before, it was earlier. And sometimes, to me, we do question, it's difficult. Are we playing God here, kan? Because this is a serious heart defect. But yet, on the other hand, there will be parents who are desperate for a child. And we can't just say, look, you're going to put your child through so many operations. You know, it's not nice and you will still have to say goodbye. But for them, it's still a chance to be with their child. But it is sad, very sad.
Because you also have to deal with the parents, right?
Of course, yeah.
The mental health of the parents as well.
What is the quality of life like for those who can live up to
40
to 50, but with that heart condition?
I've met quite a few. Somehow people who know that their end of life is shorter than others, they have a different sort of take on life. So I do see that they are more, apa orang kata, redo. What's the English word for it? Yeah, and also quite a few of them are depressed because for some they may marry, but they may not be able to give birth because of the condition. They may marry and they know they have to say goodbye to their partners, and their death is slow. You know, you have reduced punya function. Sometimes you have heart rhythm punya problems. So it's not a great punya life. But then again, on a balance, everybody would have what is your tolerance level. So it is, you know, a big scope there.
But it's sad because at that point when you're doing the procedure, the operation to extend their life as, you know, hopefully by, you know, to 40, 50 or as long as possible, that decision is made by the parents.
Yeah,
but they have
betul.
Yeah,
that's right, right?
So when you say
this is a moral punya conundrum, I guess Datin, you're coming with your background in law, talking about moral conundrums and what is somebody's right and all that. I think it is not a straightforward thing. So that's why, you know, we can give a chance for life, but is this the right quality of life that we're doing? And that's why, are we playing God here, you know? So basically, jantung ni is a pump. We have two main pumps. One pump is to go to the lungs, and the other pump is to go to the whole body. And the ones which are serious are the ones where we call a single pump punya anatomy. So when that happens, that's when we are doing the palliation and all that. So itulah. But as the number satu, I think personally, as the community of those survivors grow, there's a bit more support, there's a lot more understanding. I guess, you know, it might not be a bad thing. But you're right, sometimes parents can be selfish. This is a whole new topic to discuss as to, are we doing the right things for our child, or are we just doing it for us? Kan? Yeah.
So I suppose at the hospital you have people who would advise the parents from the emotional side. What is the
counselors?
Counselors, yeah. Counselor, do you have?
Yeah, betul. But I don't know. Well, I do hope that the thing is, counselors and psychologists and psychiatrists are in high demand. We do need them. They are there. I know dekat IJN memang ada. But yelah, sejauh mana? And you're talking about IJN being a tertiary center. People coming from all over the country. People who come across pun are those people who do not have money. I came across to this one, two brothers ni, tengah duduk on a bed. And I saw them, I said, oh, you're sharing your food. They're so poor that the brothers shared the food. They're orphans. I ni bawa banyak cerita sedih pula hari ni. But, you know, but this is the trails that we come across. They are orphans, looked after by their grandparents, 7 beradik. So the brother had a rheumatic heart disease. And this is one of the things that caused by a bacteria. So normally if you are unwell and then somehow you are unlucky enough to have that sort of bacteria yang affect your throat and you don't have access to antibiotics, it can affect your heart valves. So yang itu pun yang kita panggil rheumatic fever ni. So this child had that. But so he had prolonged stay in the hospital. But he was accompanied by his brother who was only like a year older. And they were so poor and they were just sharing their food. You know, we come across a lot of that. So we're not only talking about your actual medical problems. We're talking about social problems juga that needs to be addressed. Yeah.
You mentioned antibiotics and bacteria. So for me, there are two schools of thought.
Okay.
You let the body fight it out, and the body gets stronger, or you go for antibiotics. But then in your example, it's quite scary because if you let the body fight it out, the bacteria might go down to the heart. So how does a parent make a decision whether to, to get the child's immune system stronger or to
I'm
antibiotics?
not pro antibiotic. I let my kids fight by themselves until certain point. I think that they should get antibiotic. Only then I give them antibiotic.
Yeah, but it's scary because
It's scary now that they know.
Dr. Nomee says it can go down to the heart.
Betul. Even in the last few years, UK had lost a few children because the UK punya health system is basically crumbling. So it's so difficult to actually see a doctor. I know Daniel managed to see one, but it's so difficult to actually see a GP even.
But even in Canada, you have to wait for months.
We in Malaysia, I'm so really lucky.
Yeah, we're so lucky.
Betul.
Yeah.
So the story about antibiotics. Okay. And as a general pediatrician, I meet a lot of parents who I was like, do we really need this antibiotic? Normally, I would just say no. 90% of the time, memang caused by viruses. Now, viruses dengan bacteria are two different ball games, obviously. Viruses don't normally have any special medicine. Yang ada pun mungkin your influenza, but you have to take your Tamiflu, kan? Tetapi, unfortunately, when the body is weakened, we have bacteria all around us that can actually become invasive. So that's why yang kita ada things macam the immunization, because it's very real.
So body to fight it out or antibiotics?
I think we really need to just play it case by case. Now, 90% of the time, memang infections are caused by viruses. You don't need antibiotics for that. But unfortunately, there are going to be invasive bacteria that can cause problems. So if you have persistent fever, if the child is becoming more lethargic, you can see that maybe there are more things like increasing shortness of breath, coughing a lot sampai you cannot sleep or they cannot feed. At some point, you do need to take the antibiotics. I don't want people to think that taking antibiotics is dangerous. What's dangerous if you don't finish the course of antibiotics? Because that will produce bacteria which can develop resistance. That's the main reason why we're saying don't use antibiotics. As I was just saying, if children were born prematurely, small children, we tend to be more heavy-handed in the sense that we will start antibiotics early because they are so weak. The immune system is basically zero. So that's why also, if you notice, if you take your child to the doctors for the immunization, you have to do the same injection several times because they cannot mount an immune response like us. So for us, we take one jab, we just get the right coverage. For children, they need it again and again. So we're talking about two sectors, which are the extreme young and the extreme old. They would need antibiotics sooner rather than later. So don't worry. Both school of thoughts are correct. You just need to be able to apply it correctly.
As on the general pediatric side, what is the most common complications you see nowadays?
Most common problem would be always to do with the respiratory tract. So you're talking about your coughing, your bronchitis, your bronchiolitis, and then you have your upper airway. So you may get a tonsillitis, you may get sinus. That's the most common thing for children, mainly because they are small compared to us. And so their lungs are tiny, and you're talking about the very tiny tubes. So it's easy for a small drop of fluid to cause a lot of problems. So that's why breathing problems is the most common. The one that comes next is problems dengan diarrhea. So infections tend to be the main thing. Then we're looking at what my bread and butter. So not only do I make sure they get their immunizations, I treat those simpler cases. But then we're also looking at development, whether they're walking, they're talking, they're doing things with their hands, and whether their mental health now is a big thing. COVID, masa tu, I had like a few children who came in with depression, somebody as young as 8, I had somebody with rage issues because somehow the parent just left this 10-year-old inside a room for 2 weeks. So how can a 10-year-old handle that? And so he had a lot of rage. So we had to deal with that. So that COVID brought out a lot of mental health issues. Also speech and language juga was affected by COVID. You would have thought that parents being at home, they would talk more to their children, but it turned out no. They all had delay because they didn't go to school and that sort of thing. So that's very interesting. And I guess it's also very telling sebenarnya, working from home, the parent has to do everything. So in the end, they're working and trying to look after the house, look after the children. It's actually not very ideal. So that was one big struggle that we had to go through during COVID. Yeah, I think you perhaps yourself found any.
Well, I find it surprising. We heard about you having to quarantine separately in a room for 10 days and all that. But I'm surprised that parents actually put a child, in a room for 2 weeks.
Correct. Yeah. So when he came out, he was very angry. Yeah, very angry, and this problem continued. So had to refer and all that. I also saw quite a few girls who were anorexic. There's one child who came in walking very slowly. He sat down. I said, "Okay, what's wrong?" They kata, "Oh, she collapsed. Was sapu lantai." I said, "Okay." I said, "Let's jump onto the examination bed." And this child was wearing her tudung and all with baggy clothes. So I was just looking at her thinking, oh, she's quite, walking very slowly. And then when I just put my hand on her, I actually literally jumped back because she was just skin and bones. I have not seen. I could see that the face was very cengkung. But if you've never seen somebody in just skin and bones, you would be very surprised. It was just that she was just so weak. So basically, even her heart was slowing down because her body was shutting down. There was just not enough nutrition. So I had a few children who came in with anorexia juga. So this is, a big range of things that I'm looking at as a general pediatrician.
Yeah, and I guess in your job as well, you deal with a lot of other professionals like counselor, like therapists. How you do that? I mean, besides doing your specialization, you also have to deal with, like
other specialties.
Other specialties.
Yeah. The thing is, macam for us, especially let's say we're dealing with somebody with anorexia, which I mentioned before. We not only need specialists in psychiatry, we need a psychiatrist. We also need a behavior punya counselor. We also need a nutritionist, a dietitian. So I wish that we had more of this multidisciplinary punya approach to solving a lot of problems, because we cannot work in silos. Kalau tidak,
True. Talking about nutrition, I find that you really need nutritionists, even for parents. Because like when I was having lunch today, my son was telling me, "Okay, Mama, that drumstick has only got 12 grams of protein." Because right now this whole family is on a protein drive, you see. So he's telling me 12 grams. I was like, "Oh, really? How many grams do I need?" "Oh, about 90. How am I going to eat 90 grams of protein in a day? I've been thinking about it. When my kids were growing up, I did not think about how many grams of protein I should give them, but I should have maybe.
Yeah.
But there was no advice from, we were talking about 20 years ago, more than 20 years ago. So I feel kind of bad now. So, maybe I didn't give my kids enough protein.
I guess. I mean, I'm sure we have tried our best when we were growing up, but we didn't have the resources. But the children now know more because they've got the world at their fingertips. And I was just looking at this where they're saying Japan being the third ataupun one of the top richest countries in the world where no one's obese. And that's because every school has to have a nutritionist. Satu. So they actually really go all out on making sure you understand what's good for you. They do not promote ultra processed food. Things are done fresh every day. And I think that's very important because we see diseases now that's happening in younger and younger generation. We're seeing a huge leap in children who has been diagnosed with autism. So surely, it's not genetic, so it must be environment. So to me, it must be what we are consuming that must be causing this huge jump.
Yeah.
Why? Because I'm seeing so many of them now. So it does seem likely that we must really look at what we eat. As that adage says, lah kan, you are what you eat. I think that's very important. And I'm happy to hear your son saying that, because my son also does the same thing.
Yeah, my son.
How much protein am I taking?
Yeah.
Is he into exercise and
Yeah, he's into getting fit and all that. So he's very conscious about what he eats. Yeah.
exactly?
No, we have advice from our kids.
Betul. Yeah.
Right.
So we are doing this family punya tally of what we eat, how much sleep as well, how much water.
And also, you're mentioning the environment. So it's all these microplastics. And I now realize that you shouldn't use a non-stick pan.
Yes.
So all those things I'm like throwing out from my kitchen, non-stick pan, reduce plastic, all those things. So there isn't a study though. You were saying you see a lot of autism cases, but
And unfortunately, we have not been able to pinpoint because you cannot diagnose autism at the age as a newborn because the punya sentinel punya event is the fact that the child cannot speak. So we're expecting a child to say at least one word, mama, papa, at the age of 1 year. But if at 1 year, not a single meaningful word, so then that raises alarm bells already lah. So we will start the process of diagnosing. But we haven't been able to pinpoint, is it our food? Is it the environment, like the microplastics, exposure to other things? We're not sure yet. But there's definitely an increase.
All we can do right now is to like reduce all those things we have now which we didn't have before.
Yeah.
Like switch off the Wi-Fi at night.
Yeah.
All those things, because now all this information.
Like the Wi-Fi, stop them. But it does. That was the only way I could get my children out of the room.
Yeah.
Tutup Wi-Fi, semua keluar.
Like charging kepanasan.
Yeah, I know. Yeah, exactly. And the thing is, macam Wi-Fi and devices. One of the things I tell the young parents who come through my door, 3 things basically. Number 1, please don't use mobile devices. The big TV is fine because how are we going to sing and dance? For that, we need some sort of entertainment. As long as it's something yang tak movable. So that they cannot take it to makan, they cannot take it to the bathroom, cannot take it on the bed.
Yeah.
Number 2, one of my things that I do promote is reading. Because what reading does is that it allows you to master the language well. Unless we are all proficient in a different language yang can take it further, like Mandarin or Japanese or Korean. English is our default punya language of instruction. So once you master the language well, you will be able to read law, you'll be able to do medicine, you want to be a rocket scientist, easy. So the only way is to start them reading from an early age. And I'm sure you know that if you don't start them early, it's not going to happen. So I tell the parents to at least 5 minutes as you're putting them to bed, go through a book with them. Don't, some parents love doing this. Okay, this is apa? Ini apa? B, book. No, it's just for fun. Oh, look at this duck, quack, 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 quack. Telling stories, making out a lot of C's, making a lot of noises. Children like that. So they will see a book and they will pick it up because they understand this is where entertainment is going to be. And you have to remember that the first word that came to us was also Iqra. Baca lah. It's not baca the Quran. It's just read. That means acquisition of knowledge is super important. So, not only for language proficiency, acquisition of knowledge, it's mainly also in books sahajalah that you can learn about moral. Don't you agree?
Yeah.
You learn to empathize. You learn to be able to see somebody else from your point of view. So that's why reading is so important.
Yeah, interesting.
But nowadays kids don't really read.
My kids, my daughter, she reads.
But we have to force them to read. Those who are growing up, because those who maybe 20 years ago as kids, that reading culture was still there.
Yeah.
But now with all these devices,
it's gets harder. I think at this older age where I need the glasses, I find reading annoying because But then, there's Kindle, there's also ebooks.
Easy.
Yeah.
But it's nothing like reading a book where you flip the pages.
Yeah, and you can smell the book. Yeah, it's lovely. It's a big hobby.
Yeah.
Tapi itulah, the only way you can make sure that they pick up the reading habit is from young. So it has to be ingrained.
Yeah.
To the parents, okay, you pun kena membaca lah, buat ayo buku.
True.
There's some parents actually ask me, habis kalau saya tak bagi iPad, saya nak buat apa dengan anak saya? I'm like,
So this is
I can advice when there's no such thing as a mobile phone or an iPad. And there was always crayons. I told them, look, bring a crayon to get with you. Bring a piece of paper you can get anywhere. Crayon pun the ones yang edible kan. Yeah, so that they learn. And that helps with their dexterity and all that. Yeah, it does help.
Yeah.
So those are my 2 pet campaigns whenever I meet new parents.
Okay, this is the kind of advice you give to them lah.
Yeah. By the by lah, I mean, as well as normal things, macam feeding problems, that sort of thing.
And interesting.
Right. So we've spoken a lot about the environment and how it affects children. What about the behavior of parents?
Yes. There's also one of the other things that I talk to the young parents who come across my door. And I would say to them, listen, children don't do what you tell them to do. They will do what you do. One interesting advertisement in the UK that I saw, it was saying, watch your speed because your son is watching. So if you are worried that your son might be speeding, you must make sure that you don't speed when you're driving. So that's very telling. I'm sure as mothers, can you understand that you tell them to do benda, they will not follow. But whatever that you are doing, they will just they will talk like you, sit like you, walk like you and all that because they will follow what they see. So I do tell parents, number one, being a parent is difficult. You have to be on your best behavior. You have to show them how to resolve conflict well. You gaduh dengan your spouse or you're having a dispute, do it behind, not in front of them. Yeah. And then also tell them, having an argument is fine. But how do you resolve conflict? So you have to be that sort of role model. And you'll be surprised. Children, whatever you say, they take it very, they take it hard. Even if, say, macam, it becomes just their inner voice, the second voice. Sometimes I notice like some parents will be like, anak tu lagi-lagi jatuh. Oh, why are you so careless? Listen, they've only just learned how to walk. They're nowhere near kita punya capabilities. So if children run and then they fall, it's not their fault. But you say to them, you're so careless, you're so clumsy, that's going to be their inner voice. So what you say, don't label them in the first place, but just, brush it off. I don't know, what are your techniques in dealing with when your children are always throwing a tantrum or not following what you say? I try to use a lot of humor. I was just like, never mind. You're having a bad day, never mind. And then I just leave them in peace. Because I do feel children as they grow up, they also need their space. There are different stages. So I do talk to parents, okay, toddler macam ni. Number satu, as I'm sure you notice, everybody does well when there's a routine. If you say, okay, bangun pukul 8, bangun pukul 8. Jangan tiba-tiba pula get them up at 6 or let them sleep in until 10. Children don't do well without structure. And especially for toddlers, I would say, number satu, structure must be there. Number two, avoid getting them too tired or too hungry. Yeah, because that's when the tantrum will come in. I don't know whether your child went through this, but I had patients coming in yang hold their breath sampai pingsan, sampai fitting. One who would like slam bang his head against the floor until fracture. Doesn't he feel the pain though? Oh no, they're so angry because toddlers don't understand that egocentric. They go through that.
It doesn't stop them. They
doesn't. Yes. Suppose imagine you're so angry, you hold your breath sampai you sendiri pingsan. They have that capacity to do that.
I don't think I can hold my breath sampai pingsan.
Yeah, because we were like, okay. I'm not angry anymore.
Okay, I'm going to break the air. But kids can do that,
Yeah. So those are the stages. That's why I said, itu them not being able to control their emotions.
Yeah, cope with the emotion.
Then it happens again with the teenagers. When we have sons and they become broody and you have to give them space. So, all that the parenting is not easy, but we have to be number one, a constant example, good example for them. We have to be, and then we also have to be a constant person who is the person that they know will never leave them. Not easy lah. I do think kita pun human, to have that sort of patience. So kadang-kadang you have to be a saint to have that sort of patience when your children are acting out.
Yeah, it's something new to me. I didn't realize that if the child runs and falls, you cannot say, don't be careless. Or, you cannot say that. Well, I think I must have said that to my kids when they were growing up.
I don't know. Don't be careless is okay. But when you say, you're so clumsy, why are you so clumsy?
Oh, you're so clumsy. You can't say that.
Yeah.
Okay, all right.
Because
okay.
that's a different connotation.
Right.
Why are you it's okay. Yeah. But then, we can help it because it's a natural reaction.
We are also human. It's spontaneous.
You just clean the whole floors and then you just start spill everything again. So of course, and we are younger. We don't have that much patience. We have to work. Tired.
But even
money.
at my age now, I don't think I have patience with small kids. When I look at them, I was like, okay.
Yeah.
I was more patient, I think, when I was younger? With my kids. But now when I look at children going around and running around and jumping here and there, I just can't take it.
Yeah.
Well, I got this. What about this old school and new school?
Okay.
Because the old school, nanti okay, cubit.
Yeah.
The new school, janganlah buat macam tu. Why did you do that? It's not good.
My family is very close. So the nieces and nephews are all. They will call me the white mom. Because I don't scream, I don't shout, because I prefer to treat the children as my peer, as my friend. So to me, I guess I wanted to break the generational punya trauma, because I do feel if I cannot come to my to my mom easily, because I feel dia akan marah dulu, So I didn't want that. But then my mom's wonderful. She's always been somebody that I look up to because she's calm, she is rajin, she can do everything. But itulah, some things I thought, okay, I want it to be different for my child. So I decided to, I'm going to be the calm mother.
The favorite auntie.
The favorite auntie. I think that's a different punya culture, I remember looking, masa tu I was at Boots in the UK. So this one little girl pushed down some things from the shelf, and the father went on a long, sweet speech about why I shouldn't do something that will make other people upset. She listened. Lepas tu, bapak dia habis je. I don't know. So for you, but then I was thinking, you see how they would take the effort, not to now do that, something.
Yeah.
Yeah, I know there's different kind of
new parenting is different.
Yeah, but I think nowadays it's more challenging because children are exposed to all this on the
social media and all that. Yeah.
So you've got 10 million parents out there giving examples to your kid. So how do we navigate this? So this is different.
Very challenging.
Yeah, maybe what we can suggest is no social media for them until
certain age
they leave school.
But it's difficult once they start going to school.
Yeah, because they are friends and they talk about it. Yeah.
Yeah.
All of the advice was take away the phone at night. They don't need it to sleep. Or that's when other things come in also.
So behavior around kids, very important, because kids are like sponges.
Correct.
Yeah, they absorb everything.
But and sometimes you think, I'm not saying anything that will hurt them, but they still feel upset, Yeah. So
until what age are they very sensitive to what you say?
I would say all the way up to the teenage years.
I agree with that. I think until 15, from my own experience, 15, 16, but still very, very
sensitive.
Very sensitive.
Yeah.
Well,
Thank you.
Yeah, very insightful.
Welcome. I really enjoyed talking to both of you.
Yeah, a lot of eye openers for us.
Yes.
Even though we were parents with small children many years ago. Yeah, but we learned a lot of new things.
Yeah.
Maybe we can apply it to our grandchildren later on. Shall see.
Yeah.
These grandchildren are your reward for having children. I think that's a lovely saying.
Can't wait for that, inshallah. Both of us.
Are we all waiting?
So thank you.
Thank you again.
Sri.
Thank you. Well, I wish you all the best also with all your future interviews and all that. Yes.
Thank you.